So as we are getting into the last little bit of this here, we're going to talk a little bit about a few more changes that we see at altitude, and then getting into what might be the best way to go about training to get some of these adaptations that might help you at sea level. So at altitude, we're going to start seeing that after about 14 to 18 days, we're going to start seeing the ability to have increased fat metabolism. And this tends to increase that ability to do work and endurance time to exhaustion. It tends to be more glycogen sparing. So like we've seen with a lot of things, as you spend a little more time here, we start getting less dependent on anaerobic and more dependent on aerobic, being able to use oxygen at higher levels in order to, again, maintain glycogen levels and things along those lines. And again, this is looking at sea level, high altitude, and then longer there, looking at trying to read that. So free fatty acids, you can see they go up at chronic high altitude. This is looking at serum lactic acid. You can see it's dropped at altitude. Muscle glycogen use is decreased at altitude. And serum, I think that's glycerol, which would be fatty acid, you can see increased at altitude. So less glycogenolysis and increased fat use. So again, what's going on here? We're having a low fat, honestly, a low calorie diet. So this is going to, part of the reason we start using more and more fats is because we're not bringing in a lot of stuff here. The other thing is the nervous system. We're going to be increasing levels of norepinephrine, which will also help increase that fat mobilization to free this up a little bit. The other thing is levels of breakdown of carbohydrates decrease due to decreased enzyme activity. And we're having a lot more stuff entering that Krebs cycle as acetyl-CoA rather than going through the lactic acid pathway. Also, blood lactic acid levels are decreased, which is going to let us mobilize more fats. And again, if you have increased blood lactate levels, those inhibit fat mobilization. So the fact that we're keeping those lower are helping us out. And again, this is looking at over time. You can see initially, we know when we went to altitude, heart rate was up, trying to make up for that. Ventilation was up. Ventilation goes up and tends to stay up, where you can see heart rate tends to go up initially to make up for that, and then will slowly drop off as we spend more time there. After we spend weeks and months there, we can see we start getting much higher levels of hemoglobin concentration as well as overall levels of hemoglobin. And we are able to compensate over a few days to weeks to make up for that increase in blood pH and bring it back down to those more normoxic levels. And again, that was at rest. At exercise, you can see heart rate at sea level go higher. We don't support as high a heart rate at altitude. Part of that is due to lack of oxygen. Ventilation rate, like we said, goes up and then stays up. Stroke volume is higher at sea level, drops initially at altitude, and as we get plasma volume back, it is going to go back up. Same thing with cardiac output. And then again, that VO2 max at sea level is a certain height. It's going to decrease initially at altitude, and then over time we're going to bring that back up. But again, you can see it is not getting to sea level levels on that. So VO2 max will come back up as you adapt to altitude, but it will not be higher than what you were at sea level. That being said, if you were to be at altitude and then go back down to sea level, we may see an increase over your baseline prior to going up to altitude. So that sympathetic nervous system we're seeing those higher norepinephrine levels after about 3 to 5 days. They're going to help increase that ventilation rate, increase fat use, increase heart rate to maintain these higher levels of cardiac output. And again, this is looking at 24-hour urinary excretion of norepinephrine. So you can see at altitude, we are having more epinephrine in there, norepinephrine, because we're seeing more of it in the urine. Parasympathetic nervous system is not really affected by this. We see a little bump up in thyroxine levels and they drop back down. Outside of that, as you're at altitude longer, you are going to have some higher insulin levels and increased insulin sensitivity, so we can clear glucose a little bit better at altitude. Cortisol levels, stress hormone will be up during the first week, but eventually drop back to normal. Has a catabolic effect on tissues, lets us break down, and it's going to decrease that lean body weight like we were saying initially. Over time, as we get more norepinephrine, we are going to see increased lipolysis due to this, though. Long-term residents, like I'm saying here, have higher growth hormone levels, higher set point for growth hormone. Because of that, this does have an anabolic effect, which helps maintain that lean body mass, especially in the early stages of adaptation. And again, more fat mobilization, more use of aerobic metabolism, reduced oxygen deficit due, to this. And again, when we start seeing these decreasing plasma volumes, we generally will see increases in aldosterone to maintain that water retention as we spend more time at altitude. So one of the other things I want to talk about is a little bit about training at altitude. There's some differing opinions on some of this. Training at altitude obviously can increase your blood hemoglobin levels, your red blood cell counts, all of which would help you out at lower altitudes. But training at altitude also sometimes limits your ability to do some of these higher intensity trainings, especially when you're talking about some trainings that may help to increase your overall VO2 maximum or those very intense trainings. So there is some detrimental effects that can be seen at sea level if you're doing all your training at altitude. That being said, altitude, interval training, and other things here that are spending some time at acclimation, as long as you're doing some stuff at lower altitudes, you could possibly gain some of these benefits for endurance while also not losing out on the power and intensity levels by being able to go lower. What's kind of interesting on this one, for competition at high altitudes, generally you want to allow about 3 weeks of time to adapt. So a lot of what we're talking about here, it is about 3 weeks to start getting back to those levels. Acclimated lowlanders are going to have an edge over unacclimated ones here. But even at altitude, if you've spent and you've acclimated there, you're not going to have sea level levels of VO2 max. And again, some of this is, if you've acclimated at sea level, you're not necessarily, if you've acclimated at altitude and come back to sea level, you might not see these changes. Like it says, they're acclimated lowlanders and unacclimated lowlanders. They see that similar increase in VO2 max when they come down from sea level. The main thing is you're going to have higher levels of erythrocytes, better oxygen carrying capacity, but you may have a reduction in cardiac output, which may balance out these increases that you might be able to see. Like it says here, native highlanders, though, who have been at high altitude for long-term adaptations, have increased plasma volume, and a lot of these other changes here generally are going to have a significant advantage when they go and compete at sea level. So this is part of the reason, like the Kenyan marathoners who live at about 8,000 feet of altitude, when they are competing against other folks, have a tendency to have some of these advantages. So there's a couple different ways that they go about looking at this as in terms of ways to maybe do this. So one of them is to say live at altitude but train lower. So if you live at higher altitudes, it's going to increase your red blood cell counts, it's going to increase your hemoglobin concentration. But if you're training low, it means you can increase those intensities and velocities, the speed of your workouts, and generate some of those power and those more neuromuscular adaptations that if you're training at altitude may not be possible because you can't get that level of intensity. And again, this is going to improve those sea level maximal oxygen uptakes and endurance performance. Again, this are going to be, if you stay down at sea level, these benefits only last a short period of time. So only about 3 weeks on this, maybe a little bit longer before you get back to your baseline levels. So there is some other alternative strategies here. So live high, train to that, live high, train low to do this. Ways to do this, or if you're not at altitude, you can actually set up tents or hypobaric environments. This would stimulate some of this altitude while still being able to be at sea level. The other options are, if you're at altitude, use oxygen supplementation so you can increase your intensity at that altitude. And we do see some differences here. It's not much when you're going to altitude, but generally when you come back, men tend to maintain their red blood cell changes a little bit longer than females, is the big difference we see there. So just to kind of summarize all this and to kind of go through it in a little bit more concise fashion here at the end here, when you're looking at acclimatization to altitude, it's really about getting oxygen to these tissues. And again, we're having lower partial pressures of oxygen. So when we have that lower than normal, the body has to do different things to deal with this. It has to deal with that pressure drop during transfer. One of the ways it's going to do this by trying to increase that oxygen carrying capacity of the blood and the ability to drop more off at the tissues. The longer we stay at altitude, the better this tends to get. So a lot of what we've talked about here is the sustained hyperventilation. So when you get to altitude, we have this increased hyperventilation, gives us some respiratory alkalosis, which then we compensate for by using the kidneys to get rid of that, get that more alkaline urine and balance this out. But overall, we're going to see increased resting ventilation. And part of this is possible because of increased chemosensitivity. The thickness of the air does make the breathing a little bit easier. Overall, total lung capacity, especially in those that are natives up there, tends to be higher. They have increased barrel chesting, less dead space. One of the things that allows them to do is have increased ventilatory capacity relative to their body mass. The other thing is we tend to see some vasoconstriction and pulmonary hypertension over time. This will lead to increases in pulmonary capillaries, which is going to increase our ability to transfer oxygen across these membranes. The other thing we see over time, we get increased capillaries in the tissue relative to sea level. Along with a little bit of vasodilation, we're going to get more delivery to tissues. And over time, we have increased mitochondrial density, increased oxidative enzymes, increased myoglobin. All these things are going to increase our ability to deliver oxygen. And we also saw that polycythemia, so hypoxia, increases that EPO, which is going to give us increased hemoglobin concentrations and red blood cell counts within a few weeks. That is going to increase our ability to carry more oxygen. So even though we're not as fully saturated, we are carrying more oxygen in our blood because there's more oxygen carrying cells. And over time, we do get an increase of that plasma volume, which allows us to deliver this to these blood vessels. Deliver this to the tissues in a normal fashion. So by getting that blood volume back up, we kind of get stuff back within those normal limits. So that's a nice little summary at the end here to kind of tie this all back together again. So this is really it for some of this at altitude training. So what we'll start looking into is probably doing a little bit of cold response and then get into, like I was saying, a little bit about maybe breathing at pressurized gases as well as space type of physiology. So I will see you next time.